President Donald Trump and members of Congress are weighing cuts to one of the largest U.S. safety net programs. Medicaid, the health insurance program for people with disabilities and low-income adults, cost Washington $618 billion last year and is projected by the Congressional Budget Office to grow 60% in the coming 10 years, according to Reuters. Elon Musk's Department of Government Efficiency has been working at the Centers for Medicare and Medicaid Services, trying to uncover government waste. Meanwhile, lawmakers are divided over the potential cuts. President Trump assuring the nation in February fraud is what his administration is after.
Social Security won't be touched. Other than if there's fraud or something, we're going to find it's going to be strengthened, but won't be touched. Medicare, Medicaid.
In DOJ's February inaugural hearing, the subcommittee said the team was investigating hundreds of billions of wasted taxpayer dollars on improper payments and fraud. Some there shared plans to improve payment systems and close loopholes to decrease that fraud, deeming it a war on waste. But some who work in health access are still worried about where these discussions are headed. Adam Mueller is the executive director of the Indiana Justice Project, a nonprofit, nonpartisan law and policy center in Indiana. Mueller says we're already seeing potential changes to the program in Indiana through Senate Bill 2. Signed by the governor May 1st, the bill has a work requirement and other provisions, changes he says are causing concern.
I think people might have a lot of misconceptions about who is a Hoosier that is using Medicaid. Most people in Indiana that are on Medicaid, and this is true nationally, are either disabled or already working. Additionally, it really runs the gamut from everywhere from South Bend down to Evansville, urban populations, rural populations. Medicaid is a really big and important program for everybody.
Among those on Medicaid in Indiana, the program supports the birth of about half the babies in the state, 3 in 8 children, and 1 in 3 working-age adults with disabilities. State lawmakers debated and made changes to Senate Bill 2 before it made its way through the legislature. Those lawmakers say they've seen an unsustainable growth of Medicaid participants and that Senate Bill 2 would cap the number of Hoosiers who receive it through the state's Healthy Indiana plan. Currently, Medicaid members have their eligibility checked each year. Through Senate Bill 2, those checks could take place every 3 months.
Senate Bill 2 is an effort to provide sustainability to this Medicaid program. It's really an effort to align services with the people that need services.
Baird also points to the COVID-19 pandemic and the inability of states to disenroll people from Medicaid until March of 2023 as recent challenges for the program. But Mueller fears promises from state and federal government when it comes to cuts may not be all they seem.
I am very concerned about what the definition of fraud may be. Anybody that's ever worked, where you've had to send any information to the government, that things can get lost in the mail. That sometimes you'll get mail that you're supposed to respond to, but they don't give you enough time to respond. Somebody might look at that and say, you see, we got rid of somebody that wasn't eligible for the program. Well, it may not have been their fault that the information was lost or not processed. So there's all sorts of reasons why folks can lose coverage and error. And I'm concerned that they're going to say that that's sort of in this bucket of fraud, waste, and abuse.
Thanks for watching. Here's another story you may like. And subscribe to the WSBT 22 YouTube channel.